Hi, Tom. I'm Cecilia. Nice to meet you.
Hi, nice to meet you.
Have you ever been to therapy before?
I have not.
Okay,
No.
so there's a few things I have to go over. It is a safe space to talk. Everything you say to me is confidential. However, there are a few limits to confidentiality. For instance, if you talk about killing yourself or wanting to kill someone else, I have to report that, as well as if you discuss any child abuse or elder abuse. As a mandated reporter, I also have to report that.
Okay.
Do you have any questions about that?
No, I don't.
No?
No.
Okay. So, what brings you to therapy?
Um, well, recently I've been having a little trouble trying to balance between work and home. Haven't really been getting a lot of sleep recently, and the cause is work. Work's been pretty stressful, and
Okay.
at night I lay in bed and it just work just goes through my mind. Like it keeps me up all night, and I'm trying to find some relief towards that.
Okay. So, I'm really glad you came to therapy then. So it seems like you're kind of having a lot of trouble sleeping because you're thinking about your work day. Can you talk to me a little bit more about what your work kind of entails, what your normal work day looks like?
Yeah, so I'm a firefighter EMT, so but I have two different jobs, but the one that really takes a toll on me is just my EMT job. I work for a local hospital, and it's long shifts. They're 13-hour shifts, and I'm often working 5 to 6 days a week, and
Mhm.
I'll wake up early in the morning, I come home late at night, I go to bed, and I do it over again. And it's a lot of work because like you don't know how many calls there will be. Like sometimes there's upwards of 10, 15 calls, and
Wow.
that's really stressful. And some of the calls just aren't the easiest to cope with, and they're the ones that I kind of keep thinking about over and over again when I'm not at work. So
Okay, so that sounds really difficult. Sounds like you have a lot on your plate. That's a really long work shift for 5 to 6 days a week. I'm sure you're exhausted at the end of the day, so not being able to get to sleep is probably really difficult.
yeah,
And like you just said, some of the calls that you get are also taxing just based on the experiences or.
yeah, it's tough because we have a job to do. I mean, we're obviously supposed to care for our patients, and we have to have some heart with it. But like I said, it's our job. Like we have to remember that we have to get things done. And like recently, like we had a pretty bad accident. It was two teens, they were 18 years old,
Oh, wow.
and one was pretty severely injured. So
Mm-hmm.
you know, we did our job. We got him to the hospital, but he's still there in critical condition. And the stuff that it bothers me because I lay in bed and I think about their family, their friends. Like, what could they be thinking right now? Like, I
Right.
did everything I could, but there's still that thought on my mind that this poor teen is in pretty critical condition, and these friends and family have to try to cope with that, and that's not something that's easy.
No, that doesn't sound easy at all. I mean, I give you a lot of credit for being a first responder and doing what you do for people, but I'm sure it becomes very emotionally taxing just seeing, like you said, a car wreck and these young kids and what their families are going through. Is there anything that you feel like you do to try and kind of get your mind off of things or kind of like an outlet from work?
I mean, there's a couple things like one of the simpler things is just to go to the gym and just try to try to focus on what's happening then. Like I don't want any external factors affecting me, and that's one way to get rid of those bad thoughts. But I mean, I can talk to a couple friends. I have friends that are in the same line of work. They're firefighter EMTs as well. They've been doing it for a lot longer than me. Um, just being able to talk to them about certain calls, it kind of makes things easier on me, thinking that I'm not the only one to go through this.
Right.
There's other people out there, and I mean, I have a wonderful girlfriend that I'm able to speak to. She understands.
Yeah.
She kind of helps me through it all. Like she's been there for me, so that's it's a good thing to have, and I'm very happy that I have those resources.
Well, I'm glad that you have them. I'm glad that, you're going to the gym, kind of using that as a tool to, ease some of your anxiety. I'm also glad that you have like a support system, you said with your friends, your girlfriend. I know before you talked about, that we have to make sure that we're, staying professional in the job. Is that like your EMT friends, your firefighter friends that you're referring to, that kind of are your support system?
Yeah, I have partners. I have also have friends that are back at home.
Mm-hmm.
We're all in the same line of work. I mean, my partners at work, they're kind of the older generation, so they've been doing this work for 20, 30, 40 years, but I have to keep up with what my job entails. I can't, or I'd rather not come off as the person who can't take a call because I'm overthinking it, or I'm still thinking about the last call, because that's not my job. That's my job is, I signed up for this. I'm supposed to do this, and I have to have some heart for it, but I also have to get the job done. And the last thing I want is to come off as someone who is not fit for their job.
Mm-hmm.
But my friends say they're easier to talk to because they relate to me easier. They relate to me better. They understand me on a more personal level, so it's easier to express my feelings to them.
Yeah, I'm really happy that you have them to talk to, because it does sound really frustrating having to, kind of like suck it up when you just dealt with a really emotional, really tragic case, and then you just have to go to the next call. I'm sure that gets really difficult. And you talked about how it's like it's difficult for you to sleep because you can't stop thinking about it. Do you feel like when you talk about it with your friends, when you go to the gym, when you talk about it with your girlfriend, do you feel like it's kind of relieving some of that overthinking about it or dwelling on the situations that have happened?
It helps. It helps scrape off the outer layer, basically. So when I talk to my friends or when I talk to my partners about the accident, it gets me through the easy stuff. We talk about something that we all go through, but then there's the deeper stuff about the victim, the patient's family, the patient's friends. That's the stuff that's not as easy to get into and kind of get rid of. It's something that lingers, and that's what comes up every night, and that's what keeps me awake. So I'm just trying to find a better way to dig deeper and try to express my emotions and feelings about that kind of stuff.
Right, yeah, that does seem like it's something that would keep you up at night. I'm sorry that it's taking such a toll on your home life, on sleeping. But I really am glad you came to therapy, because I really hope we can find some sort of tools or any other kind of outlets that can help you kind of, make sense of these feelings, helping the like overthinking some of it, not really leaving work at work, and letting it really creep into your home life, because it does seem like it is taking a toll on you emotionally and physically if you're not sleeping. So I look forward to doing that more. I'm, like I said, like I give you a lot of credit for being an EMT, a firefighter, and being a first responder in general. You're the first person that gets there to an accident, so you're doing a lot. Do you find that you do feel like a sense of pride from working as your job, or like a sense of like you're in the right career?
Yeah, I mean, that's what I was saying. We signed up for it. We have a job to do, and that's what keeps me going, because I'm able to do my job. I haven't really let it affect my work, and that's something that I look forward to. I'm helping people. I like to see the positive outcomes, but every negative outcome or every something that lingers is what I'm trying to push away to keep
Right.
to keep me motivated.
Right. Yeah, that sounds hard, and I'm glad that you still have the positives as well. So, I hope that we can continue to make it more positive for you. We are coming to the end of our session, so I wanted to ask you if there's anything you wish we would have talked about now, or anything you want to talk about in the next session that we can explore further.
I guess I would be interested in digging a little bit more into my thoughts about like what goes through my head at night. Like it, I know I said I've only been able to scrape off the outer layer, but I'm willing and ready to try to dive in and tackle the negative thoughts, and I'm excited to try to do that.
Great. Yeah, I'm really looking forward to working with you and further, trying to figure out some of those thoughts. All right. So thank you for coming in.
Thank you.